Dr. Jackman, you know, everybody's heard about that Atlantic bubble, kind of among the lowest COVID-19 numbers in Canada. Have those low numbers carried over into First Nations community in the Atlantic region?
Yeah, so thanks for having me here today. In general, we've been doing quite well in Atlantic Canada. The numbers continue to be low. There have been some cases in First Nations communities in New Brunswick and Nova Scotia, but thanks to strong public health leadership as well as very strong community leadership, those numbers have stayed low, they were well managed, and the communities did very well with it. So it was really a coordinated, strong, and effective effort between public health and the communities and their leadership.
Is there vaccine reluctance on First Nations communities in Atlantic Canada? I know we're seeing that in some other communities, and you know, rightfully so. Historically, vaccines and Indigenous populations have not a great history. Is that happening there? And what's the response from the health community, I guess, if it is?
Yeah, so great question. As you've said, we tend to see some vaccine hesitancy across Canada, and is my understanding that Atlantic Canada isn't immune to that. We've had lots of really good conversations with communities, community leadership like the chiefs, as well as the health directors. And we have heard from leaders that they hear concerns with community members having questions around vaccine, maybe having some hesitance or just not being as confident in the vaccine. So what we've been doing in Indigenous Services Canada, and part of my role, is we've been doing a lot of education efforts with communities, supporting them in making sure they have the resources to give to their communities to answer questions, because it's okay for people to have questions around vaccines, and we welcome questions. So our main role has been supporting communities and the leadership in answering those questions with any resources. We've done a couple of town halls, and those have gone really well. We've gotten really great feedback from the chiefs that some of those education efforts are really helping people have their questions around the vaccine answered and helping with their confidence in the COVID vaccine, which is really important for people to have to protect themselves against COVID. So it's been going quite well in that regard, and we continue to support the communities with any questions they have.
I'll go now. We had asked some of our viewers, you know, do you have a question for a doctor? And when they've responded, as we anticipated they would, lots of great questions out there. I'll give you a couple. Somebody has asked, has anybody with a compromised immune system and kidney disease received the vaccine? Is this something that you have to worry about if you have kidney disease getting the vaccine?
So it's a good question, and for situations where someone has a medical condition or has any specific concerns that relates to their own kind of health as it relates to the vaccine, what we do is we encourage people to connect with their healthcare provider, whether that's a nursing professional in the community that they trust, or a physician, or some other healthcare professional in the community that they trust, to discuss their current personal health situation to make sure that the vaccine is the right choice for them at any given moment. So we encourage those conversations between an individual and their healthcare provider to make sure it's the best fit.
Makes sense. Well, thank you, Dr. Jackman, for taking time out of your busy day. Thanks for everything you in the medical profession do for us, and for answering some of the questions here for us today.
No problem. Thank you for having me.